Hi, I'm Dr. Nancy Landgraff, and I chair the Department of Graduate Studies in Health and Rehabilitation Sciences, and I'm also the program director for the physical therapy program. And I'm here to talk to you today about the physical therapy program. Physical therapy is an entry-level doctoral degree, but why is it important for you to know about now as you're thinking about YSU for your potential place to go to school? Because there's many good undergraduate programs that feed very well into applying to physical therapy school. Things such as our biology department, our exercise science program, but you can have any undergraduate degree to pursue physical therapy. You just have to get our prerequisite classes. Those classes are heavy in the sciences, so biology, chemistry, physics, as well as a psychology, and then there's a few other things like a statistics and other classes. All that information can be found on our website. We welcome students that come into YSU to think about applying to physical therapy school and being part of our Future PT Club, which is an undergraduate organization that is advised by physical therapy faculty, and they get to meet and learn about the profession while they're here in their undergraduate programs. In physical therapy school, our program is an 8-semester program, so you're actually done about 1 semester earlier than a lot of other schools. So we admit in the summer in May, and it's a competitive admissions process. And then we go from May all the way a year, 2.5 years later, to December, 2.5 years later. The last 2 semesters, summer and fall of the final year, are all clinical experiences, and we have clinical sites all over the country. While you're in physical therapy school, you are trained to be a general physical therapist. So you have to know about orthopedics and about neuromuscular problems and people that are in the hospital, how do we take care of them? And we treat everybody from the young infants in the intensive care unit all the way through our older adult population. So you will learn about everything, but there are opportunities to pursue special interests by either attaching to a faculty member that is in an area that you think you want to be a specialist in, like orthopedics or manual therapy or neurologic problems. And you can spend time with that faculty member and learn more about that, as well as your clinical experiences. While one has to be inpatient and one has to be outpatient, you also will have one that you can kind of choose, like if you're interested in pediatrics, and we work with you on that. I have 2 directors of clinical education, and they spend time working with the students to figure out where they want that part of their education to take place. And as I said, we have contracts all over the country. At the end of your physical therapy education, you will prepare yourself to take the national board exam. And after you pass the national board exam, you will be ready for practice. The physical therapy program is accredited by the Commission on Accreditation of Physical Therapy Education, CAPTE for short. And the commission is doing another site visit in 2025. We currently have 10 years of accreditation, and they'll be back to hopefully re-accredit us for another 10 years at that time.